Hi friends, this is Dr. Balakumari. In this video, I'll tell you about the tubal patency test called as SSG and HSG. These are basic tests that are needed for any woman who is trying to become pregnant. You all know that there are two tubes on either side of the uterus. This is the passage through which the sperm travels to meet the ovum. That is the place, the fallopian tubes, where the fertilization actually takes place. So the tubes have to be patent or open for the sperms to travel and meet the egg. How do we do the test? We usually inject a saline or a dye into the uterine mouth and then see whether it travels through the uterus and the fallopian tubes and falls into the abdominal cavity. If this procedure is done and visualized through a scan, we call it SSG, sonosalpingography. If the same procedure is visualized with an X-ray, we call it an HSG. One lady came to me. She said, I have done all the basic tests, doctor. They said the scan is normal, blood test normal, semen analysis normal. Now they want me to do an SSG. Should I do when everything is normal in the scan? Can the scan make out whether the tubes are patent or not? The simple scans done in the outpatient clinic cannot visualize the tubes. Only when we inject a fluid and then see through what is called as color Doppler, we will be able to see the movement of the fluid into the tubes and its fall into the abdominal cavity. Another lady came. She said, I already have one child. I had 2 abortions. I've been trying for pregnancy since past 5 years, but it's not happening. Now, why should I do an SSG? I already have one child. That means my tubes are okay, right? They were okay, but we do not know whether they are okay now. Generally, tubal blocks happen after an infection, and this infection is common after delivery and an abortion. So even if the woman has become pregnant before, this SSG needs to be done if needed when she is trying for a second pregnancy. Another lady came. She said, I did a HSG. It says both the tubes are blocked. Now they are advising me to go for a laparoscopy. Should I do a laparoscopy? It is an invasive procedure, isn't it? It is expensive also. I don't want to undergo that procedure. Is there an alternative? The tests HSG and SSG are actually indirect tests. We don't actually see the tubes. If inadequate fluid is injected, or if the patient is not able to bear the pain during the procedure, the tubes may contract and may give a false negative result. That is, even though the tubes are normal and open, the SSG and HSG might say that the tubes are blocked. In this case, the best way to confirm the tubal patency is by laparoscopy. But since it's an invasive procedure and a surgery, you can redo the SSG or HSG under anesthesia in a relaxed condition and see whether it is okay. When should you do the test? It is preferable to do the test 3 to 4 days after the periods are over. During menstruation, the endometrium is completely peeled off and then shed. Then after that, there is a healing process that's happening, the reformation of endometrium that is usually complete 3 to 4 days after the menstruation stops. So it's preferable to do around 7th, 8th or 9th day. We generally don't do this procedure after the ovulation day because if there is ovulation and fertilization, sometimes the procedure may flush out the egg that is formed in the tubes. So we don't want to do this procedure after the day of ovulation. It is a daycare procedure. It is slightly painful, but if you are very worried about your pain, you can request your doctor to give anesthesia and do the procedure. But if you do with anesthesia, the expenditure triples or even becomes 4 times the simple procedure that is done without anesthesia. You may have a little cramps and a little spotting 2 to 3 days after the procedure. You can try pregnancy even in the same cycle that we do the SSG. If there is an unusual lower abdomen pain or fever after the procedure, you should consult your doctor. If there is already a tubal infection, this procedure may aggravate it. So, if there is any signs of infection, please consult your doctor. In fact, before doing the procedure, if you have an unusual white discharge which is producing burning, itching, or with an altered smell, you should get it treated before you do the procedure. Thank you for watching this video. I hope you like the video. Share with your friends who need it. Comment and subscribe. See you in the next video.